Attachment disorders that we'll be subsequently discussing, it's basically a broader term which basically consists of the mood, behavior, and the social relationships that the child exhibit, and that is basically due to the relationship that the child had with his or her primary caregiver in his or her early childhood. So that is going to result in the moods, the behavior of that individual that he's going to conduct throughout his life, and even throughout the later childhood or even the adolescent age groups are affected moreover due to these attachment disorders. So the early childhood history is again very important over here. Taking the history would reveal the significant points over here that would basically emphasize on the kind of childhood that the child experienced, and that is going to affect the later on behavior, the moods of that individual, the interrelationships, the peer relationships that he's going to develop, and what kinds of behaviors he's going to exhibit throughout his childhood, throughout his adolescent and adult life. So one has to be very careful. The risk factors are again the early childhood factors and the relationships with the primary caregivers. Now, when we say the primary caregivers, it can be the parents, it can be the individuals who took care of that child in their early childhood. So having more than one primary givers, they have their own impact. So it's again very important. We'll be dealing with the definitions related to the primary caregivers, the secondary caregivers, as well as the attachment disorders in this section. So first of all, there are different kinds of attachments the child can develop. It can range from the secure attachments, and then we have the unsecure attachments. We have a range of unsecure attachments. It can be an ambivalent attachment, it can be a disorganized attachment, and then it can be an avoidant behavior that the child develops. So basically, an unsecure attachment can result into these kinds of behaviors, being an ambivalent person, being a disorganized person, or the child can also exhibit the avoidant behavior with the parents and with the people who are surrounding him. So defining basically these attachments and these kind of behaviors, they are basically exhibited depending upon the personality traits of the child himself or herself. The risk factors, they were basically provided by the primary caregivers and the experiences the child had during his or her early childhood. So this is basically the causative factors of the attachment disorders that we'll be discussing over here in this section. The concept of attachment, to basically explain this concept, is very important over here. When we define attachment, it basically refers to a specific type of biologically based relationship which provides a secure base from which the children can explore the world. So providing this secure place to which the child can basically come back, he or she can explore the world while he goes to the school, or while he moves about and plays in the playground, and then he knows that he has the parents at the backhand, he can go and find safety over there. So if this secure relationship has not been developed, that trust relationship, that trusted relationship has not been developed with the primary caregivers, these attachment disorders develop subsequently. The types of the attachments that the person can develop, it can be a secure attachment in which the child feels that he has developed that trusted relationship with the parents. He or she can trust the parents that they will come back for the child whenever he or she is in danger. So it's basically a secure kind of a relationship. Then we have an unsecure relationship or an unsecure attachment that the child can also develop, and there are multiple reasons for the development of this unsecured attachment in the individual's life, in the life of the child. So we'll be discussing the risk factors of developing this unsecure attachment. What factors basically makes the person more prone to the development of these unsecured feelings? We'll be discussing them over here. First of all, we have the ambivalent behaviors that the child can basically develop. Then we have the avoidant behavior, in which basically what happens is the child will avoid the parents and the primary caregivers. It's basically a kind of a protective behavior for the child himself or herself. He will be basically more friendly, more social while we were discussing the ambivalent behavior, in that behavior comparatively the child will be unsocial and he'll be basically failing to trust even other people in his or her life. So developing these ambivalent and avoidant behaviors is again very important. And then we have the disorganized behavior as well, that can be seen, and that is more of the aggressive kind. So these are the different kinds of behaviors that the child can develop from the unsecure relationship or from the unsecure attachments that the child experienced during the early childhood with his or her primary caregivers. The role of the primary caregiver is very important over here. The caregiver should be more reliable. The caregiver should be self-confident, confident about the world as well. The child should know how to explore the world. The caregiver should provide all the facilities and all the attachments that the child should basically explore the world around him. And then he or she is always there to provide protection to the child. So this is the relationship that a normal parent develops with the child. But if that relationship has not been developed due to multiple reasons, it can be a single parent upbringing, it can be any other reasons. For example, if the primary caregiver was not confident, he or she was depressed himself or herself, or they were suffering from some sort of a psychiatric illness and they were not being confident about the world, then the child will also become unconfident or inconfident about his surroundings and will develop all those attachment disorders that we were talking about. Separate easily from the caregivers. So the children who are basically having the primary caregivers who are self-confident and they're confident about the world and they're providing them all the opportunities to explore the world, then the child will have no difficulties in separating from the parent because he won't get anxious due to that separation. Then what are the causes of the unsecure attachment is again very important. The primary caregivers with the history of postnatal depression, unwanted pregnancy, the adverse perinatal illnesses, they can also result in the development of the unsecure attachment between the parent and the child, and then the parental illnesses. Now, these illnesses can be of the physical kind, and it can also be of the psychiatric origin. For example, if the mother or the father was suffering from some sort of a schizophrenia, schizoaffective disorders, mood disorders, all of these can also relate to the development of the unsecure attachment. Then having the history of abuse and neglect. Even if the primary giver had the history of abuse or the neglect, then even the development of the unsecure attachment is seen in these individuals or in these children whose parents are suffering from all of these problems. The temperament clash between the child and the primary caregiver. So it's one of the causes over here that we can see. Then we have the ambivalent attachment. So what is the criteria that is going to basically indicate that the child has developed that ambivalent behavior due to that unsecure attachment? The child is going to be very anxious and the child is going to act quite clingy towards his parents. This is one of the characteristics. The fear to try anything new. The child is going to lack confidence. Even when the parent offers comfort, they are more aggressive. So the aggressive component is quite commonly seen in these individuals. They vary off strangers. They don't trust people around them. They are basically more of the unsocial kind. Developing friendships and maintaining those peer relationships are quite difficult for these children. And then they struggle to trust someone. So these are the attachment behaviors due to the development of the unsecure attachment, and the ambivalent behavior is sometimes seen in these children. Then we have the avoidant behavior that is sometimes seen. Now, children suffering from these kind of avoidant behavior, they tend to avoid the primary caregivers. This is basically a protective factor that they have developed with time. Even when they learn, when they leave them, the children won't basically react to the parents leaving them. They won't cry. They would separate easily from the parents. And this is basically the avoidant behavior that we're talking about. They're basically going to avoid their primary caregivers. They do not reject comfort from the parent. They do not seek affection from the parents. And often these children are friendly and socially skilled. So this is the difference. This is a primary difference from the ambivalent behavior, that these children suffering from the avoidant behavior, they're going to be quite friendly to the other individuals surrounding them. They experienced multiple caregivers. So this is one of the risk factor that we can consider. As adults, they have difficulty in intimacy and they struggle to share thoughts and are more self-reliant. Then we have the disorganized attachment. It's basically a combination of the ambivalent and then the avoidant behavior that these individuals will be suffering from. The characteristics of secure attachment that we'll be discussing over here are, as children, they're able to separate from a parent, they seek comfort from parents while frightened, the return to the parents is met with the positive emotions, and they prefer parents to the strangers. So this is a normal behavior seen in the children. And then we have adults on the other hand. They have trusting, lasting relationships. They tend to have good self-esteem, comfortable sharing feeling with friends and partners, and they seek social supports as well. So in this section, basically, we summarize the attachment behaviors or the attachment disorders the child is going to suffer from. So that is the end of this section. Thank you for watching sqadia.com.